a sepsis survivor, I'm well aware of the importance of fluids, particularly in the initial stages of the treatment. But, you know, in talking to my friends, I get the same impression that they would never think that getting fluids could cause any harm. And it's only, I guess, about a year ago that I started to think about this and read more about this. Okay. As a patient, you know, I never thought of fluids as a drug. It just didn't occur to me. And certainly never thought that getting too much fluid would be like a drug overdose that could harm me. That just didn't come into any way of my thinking. So let's move on, and I'll tell you a wee bit more about myself. Okay. This is me before sepsis. It was taken in October 2012. And at that stage, you know, I was very fit, you know, I was healthy, I was working. But just 6 months later, I began to feel unwell. And, you know, all I had was a sore throat. And then it developed into what we term as flu-like symptoms. But that got really bad and I became violently sick, to the point that I really thought that, you know, I was going to die. Later in the day, my wife called the local surgery and they couldn't send anyone out. So later in the evening, I spoke to a doctor and the doctor had told me to take some paracetamol and come and see me in the morning. Okay, you'll see from this slide, that is me just 6 hours after the phone call. I was in a coma and I was fighting for my life with a minimum chance of survival. So I was in this coma for 3 weeks and hospitalized between 3 hospitals for a total of, I think it was around 7 months. Okay, so things have changed. As you can see, I have no lower legs. Both my legs had to be amputated below the knee, and I've lost the tops of 3 fingers on each hand. So there's been a huge change in me. And I think this is really one of the main issues when I developed sepsis for the second time. And I can maybe elaborate on that one. Okay. As you can see from this simple illustration, my weight has definitely changed. And I believe that weight is an important issue, you know, when talking about fluids. Remember, I'm not a medical person. And also my height. I have great delight in telling my friends, and they get a good laugh about this one. After my amputations, I decided to try and buy some life insurance. And I had a telephone conversation with an insurance agent. The insurance agent didn't know anything about me. I just got on the phone and we were having a conversation. And it was only when it got to the question, when the insurance agent asked me what height I was, that things got a wee bit tricky for me. And after a few seconds, not knowing what to say, I said to the insurance agent, well, I used to be 5'11", but now I'm only 4'10". And at that stage, the conversation came to an abrupt end, and I'm afraid I've never been able to get life insurance since then. Okay, so in 2018, I was admitted again to A&E with pneumonia, and they discovered I also had sepsis. And when I got into A&E, I unclipped my prosthetic legs. And on the little slide on the right-hand side, you can see that there's what we call a liner that goes on the residual limb, the stump, and the leg is hooked onto that. And of course, I have two of these, and the liner is made of silicone, and you know, it really grips the stump quite tightly. So when they started to administer the fluid, I started to get pain in my legs, and it just seemed to get worse and worse. And it got to the point I could hardly stand the pain after they started administering the fluid. Now, in the room at that time was my wife and my youngest son. I tried to say to the nurse about this situation, that I had this pain in my legs, but he didn't seem to grasp what I was meaning. So I just asked my son if he could take the liners off, which he did. As soon as the liners came off, it was amazing. There was just an instant relief. The pain, you know, had gone. And I realized that the tightness of the liner on my limbs was preventing my stumps from expanding, you know, when the fluid went into the stumps. I actually didn't know what was happening at that time, and I just got from the situation that the nurse who was there didn't understand the situation either. And this little quotation comes to mind, that I think the pressure is that uneasy feeling you feel when you're just unprepared for something. I certainly wasn't prepared for it, and I don't think the nurse that was on duty working with me wasn't sure about the situation either. Okay. Not long after that, I started to gasp for air. I could feel a pressure on my chest. It was as if someone was actually sitting on my chest. It was terrible. I was trying to breathe, but I was struggling to breathe for this pressure. Then the monitor that was attached to me started to sound an alarm. And up on the screen came the word apnea, and that's what's circled there. And in fact, I had stopped breathing. I remember a doctor whose face was close up to me, tapping my chest and saying, "Come on, David, just breathe. Give us a breath, give us a breath." Now, I wanted to breathe. With every fiber of my being, I wanted to breathe, but I just couldn't with this pressure. And so, okay, all I could do was exhale. I just exhaled as if I was making room for the breath. And I'm not sure if it was a natural reaction, whatever, but I took in a breath. Okay, it was a big breath. I mean, I wasn't sure if I was going to keep on breathing, but I was so thankful to be able to take in air again. I was able to breathe. It wasn't, you know, I was expanding my chest greatly, but so thankful that I was able to breathe again. Okay, now, as a sepsis survivor and as a volunteer for the UK Sepsis Trust, I do quite a lot of presentations and talks along with my wife, Margaret. And I think a lot about these things. And what happened to me in that A&E bay, I've thought about quite a lot. And I thought about the nurse's reaction, about my not understanding the situation. And the first thing that comes to mind, okay, we'll go to the next slide for this one, is mindfulness, and I'm not talking about mindfulness as in meditation. I'm talking about being mindful, and otherwise, as it says, as Ellen Langer says in her book Counterclockwise, noticing the differences. It's the essence of mindfulness. And we know when I was lying there was differences. I had no legs. I had these liners on. And in her other book, Mindfulness, she talks about being mindful, and otherwise being totally focused on what's happening allows us to be engaged in what we are doing. Okay. Now, I've done quite a bit of reading since I began to understand a wee bit more about fluids. And I came across several papers. I could list many. I'm only going to look at two. And then this one came from a paper from South Africa regarding intravenous fluids. And the conclusion was this project found suboptimal fluid prescribing, weak communication of fluid prescribing between staff in a regional hospital. And although this was in the Eastern Cape province of South Africa, it was this last sentence that really got me. It said, this has also been shown to occur internationally and may cause patient harm. Okay, this next one is a wee bit closer to home and is from this year. And in the summary, I've picked out two areas. Errors in fluid prescribing are common and can lead to harm, and guidelines from NICE are available to improve the quality of fluid prescribing, but are poorly adhered to. And, you know, as a patient, that doesn't exactly fill me with confidence about the situation regarding intravenous fluid prescribing. Okay. As Dr. Bernard Lone says, do as much as possible for the patient and as little as possible to the patient. Okay. I've survived, you know, I've survived sepsis twice, but looking back, certainly to the second episode of sepsis, I've survived the treatment as well. And I think this is an important statement, that understanding and improving how patients experience their care is a key component to successfully delivering high quality services that are based on their needs. Okay. So that's the end of my presentation. Thank you for the privilege of being able to share my story with you. Thank you.